Hi, so I'm Dr. Chad McGee, and this is Wyatt, and we're going to be talking about laminitis here. So what is laminitis? So laminitis is inflammation within the lamina of their foot. So basically, how their hoof is connected to their coffin bone, their hoof's basically, it's analogous to your fingernail. So where your fingernail is connected to the very tip of your finger, the bone in there, that's the same with their hoof. So you have non-sensitive lamina and sensitive lamina, and when these sensitive lamina become inflamed, it loses its connection, and that's what laminitis is. Things that should tip you off that your horse may be having an issue with laminitis, they're going to be sore. Like I said, it's excruciatingly painful. So they're going to be sore. They're going to be very reluctant to walk. Oftentimes you'll see them in that typical parked out stance where they're trying to keep their front feet out in front of them, and the reason they do that is they're trying to distribute more of their weight onto their hind end. Typically laminitis sets out in the front feet more often than not, but certainly if you have similar things that we're going to be talking about with ways to discern that you're dealing with laminitis, if you have that just in the hind feet alone, by all means certainly do not rule out laminitis. Things that should tip you off that you're dealing with laminitis. Oftentimes, the things that I had just mentioned as far as them being very uncomfortable, being able to get a digital pulse. So on your horse, if you run your finger from front to back along their fetlock, right in this region through here, you'll feel something blip under your finger that kind of feels like the tendons on the back of your hand. That's the digital vein, artery, and nerve, and it's a great location to feel for a pulse. You can also feel it on the inside of the leg right here as well. If you're able to put your hand on there and it's really strong and prominent and throbbing and really pounding away, that's what we would consider an increased pulse. It's not the rate, it's the pulse quality. If their feet are hot, that's another thing that you hear people say. In my practice, I have a lot of older horses. Some of the more common things that I wind up seeing in my practice for causes of laminitis, endocrine disorders, so Cushing's, metabolic syndrome. In addition to that, fevers are another thing that can lead to laminitis as well. If it's an endocrine disorder, say you have a horse that has Cushing's, make sure that they are on the appropriate dose of percent in order to help keep that under control. If it's metabolic syndrome, trying to keep weight off of that horse, trying to keep them in exercise, these are all things that are going to help to increase insulin sensitivity and help to prevent them from having a laminitic episode. Certain times of the year you're going to have grass that winds up being more stressed than others, and there's certainly a lot of horses that really don't need grass. One of the things that we can do with that is just by putting a grazing muzzle on them, and I don't think you'd like it. But so hopefully we've helped answer some of your questions again here, and having a good day.